Nell'ambito delle attività del Centro Studi Scienze della Vita ci occupiamo oggi di oncologia e abbiamo il piacere di avere uno dei più grandi oncologi a livello internazionale, il professor Philip Salem, docente universitario di oncologia medica all'Università del Texas. Il professor Salem è stato già direttore dell'MD Anderson Cancer Center di Houston e adesso dirige il programma della St. Luke Episcopal Cancer Center per l'oncologia. Oggi milioni di persone sono affetti da malattie oncoematologiche che rappresentano la seconda causa di morte nei paesi occidentali e sentiremo quali sono le innovazioni terapeutiche e tecnologiche in questo campo di applicazione.
Nel panorama oncologico italiano l'Associazione della Ricerca per le Terapie Oncologiche Integrate è una nuova associazione. Fino adesso si è guardato poco a quelle che possono essere le problematiche generali della terapia oncologica integrata. D'ora in poi speriamo che anche altri colleghi possano avere questo tipo di atteggiamento per migliorare soprattutto le potenzialità del paziente e per farlo stare anche dal punto di vista fisico meglio durante l'associazione con la chemioterapia o altre terapie.
Good morning, Dr. Salem. These are a series of questions for you. The first one is cure and cancer, a different approach. Professor Salem, what is your experience? In what way cancer is cured? In what does it consist, your fight against cancer, in that phrase that you say, assistance beyond medicine?
I have been in cancer medicine for 42 years, and I have learned that the most important basic component of treatment is scientific knowledge. Scientific knowledge is a key to the success of treatment and to the cure of the patient. But I believe what's lacking all over the world is two other components of therapy which are not being emphasized as much as they need to be emphasized. And that's the importance of supportive therapy and of what I refer to as a humanotherapy. Supportive therapy is that component of therapy that would prevent side effects of the treatment of cancer and would allow the patient to live more or less a quality of life which is close to normal. Humanotherapy means the treatment of a patient as a whole, as a person, as a human being, and not only an object with a disease. In cancer, we do not treat the disease itself as much as we treat a human being who has the disease. And there is a big difference in both philosophies.
What is your meaning of the word integrated therapy then?
Integrated therapy means to integrate together supportive therapy plus humanotherapy plus scientific therapy in a cohesive manner. And that will take a team rather of doctors and nurses rather than a single doctor. You see, in many diseases, the patient may need one doctor to be treated. But in cancer, you need a team of experts and paramedical personnel to deliver this integrated approach to therapy.
So what are the points that are key to follow in order to arrive at cure?
To arrive, first let me emphasize that right now, April 2010, we can cure at least 40 to 50% of all patients who seek medical help with the diagnosis of cancer. But to achieve a cure, you need three important elements. First, most up-to-date modern scientific treatment. Two, you need a lot of perseverance and courage on the side of the patient to walk through this journey. And here the doctor has an extremely important role to shepherd the patient throughout this journey. Three, you need access. The patient needs to have access to medical care and supportive therapy 24 hours a day, 7 days a week, 52 weeks a year. A treatment cannot be discontinued and cannot be interrupted. Continuity of care is an essential component of achieving a cure. And this is a problem not only in Europe, but all over the world, that patients may not be able to have access to their medical team 24 hours a day, 7 days a week, 52 weeks a year.
Hope. What role does hope have in the fight against cancer?
Hope is an extremely important component of therapy. I'm strongly in disagreement with physicians who believe that truth is more important than the patient. My motto is that the patient is by far more important than what the doctor might consider a truth. This is a profound philosophical difference. I do not believe that doctors have the right to strip patients out of hope. Hope is essential to make the patient walk through this difficult journey and through this difficult tunnel. If the patient cannot walk through this journey, the patient will collapse and will succumb to his disease. So I'm a great believer in the power of hope.
Difference between protocols of therapy for chemotherapy in Italy and in America. Are they the same in the whole world?
I do not believe in Italian protocols versus American protocols. I believe there is a good protocol and less good protocol. And I must emphasize that Italy and Italian scientists and physicians have contributed a great deal to cancer research and to cancer medicine. This is a country which is quite advanced in cancer research, and there are excellent Italian doctors. But I do not believe that the Italians have to copy the Americans, or the Americans have to copy another country. I believe in designing a protocol which is the best for the patient. And here I would like to emphasize that when we design a protocol for a patient, that protocol should be the very best for that specific patient. I do not believe that research should be done at the expense of the patient. I believe the patient should never be sacrificed for the sake of research. I believe that research should be in the service of the patient rather than the patient being in the service of research. And that's why I believe that any protocol delivered to the care of an individual patient, that protocol should be the very best for that patient. And once we acquire more knowledge that would demand modification of that protocol should be modified. The important concept here is what is important is the patient and not the protocol.
In what way is it possible to avoid errors that sometimes occur in diagnosis and by consequence to execute an erroneous therapy?
Sure. This is, in my opinion, an extremely important question because many errors occur. And the most important error would occur at the first level, at the level of diagnosis. Patients and many physicians may not know that to make a definitive diagnosis, it takes two things. You have to have an expert pathologist who is ready to consult with other pathologists. Group consultations are extremely important. And two, you need a physician, a treating physician, who communicates with the pathologist. Sometimes the pathologist may not be able to reach a definitive diagnosis unless he has enough clinical material. So the diagnosis of cancer should always be a joint responsibility between the treating physician and the pathologist. And my message to the pathologist here is to consult and to do group consultations among themselves to reduce errors. Number two, errors could occur at the level of assessing the anatomic extent of disease and what we call as a staging. This is the process where we determine whether the disease has spread to other organs or not. And here I would like to emphasize that in most patients, we need to have a thorough, adequate, complete evaluation. It's not enough to do 1 or 2 or 3 tests. Sometimes you need to do more tests to make sure that you know the topography of the disease in the body. One of the most important imaging studies in cancer, which in my opinion is underutilized, is the PET scan, because the PET scan is a recent technology which is extremely sensitive to detect cancer in different sites. And this technology is not used to its fullest, neither in Europe nor in America. And I believe this is a very important imaging study. At the third level, after we determine the diagnosis and we determine stage, we come to determine a treatment. Also at this level, the strategy of a treatment should not be designed by a single doctor. I'm a great believer in group consultations. Once we finish the evaluation of the patient, we determine the right diagnosis, the right stage. We need to sit down, have a group consultation, and include the pathologist, the surgeon, the radiotherapist, and the medical oncologist, and the paramedical personnel, and the diagnostic radiologist to design a strategy for therapy. A strategy for therapy should not be designed by a single physician. And the best guarantee for reducing errors in treatment is this model of group consultations.
How important is prevention?
In my opinion, the most important issue in cancer medicine now is prevention. If we can prevent cancer, we don't only lower cost, but we lower something far more important than cost, human suffering. And I'm going to give you examples of how we can prevent cancer. For example, colon cancer is easily early detectable and preventable by doing regular colonoscopies. So patients who come from families with high risk for colon cancer should make sure to undergo regular colonoscopies, because when you discover colon cancer at an early stage, the disease is highly curable. The same thing about breast cancer. Breast cancer now is preventable to a certain degree, and early detection would lead to a high rate of cure. If women would undergo the rules for early detection with mammography, and now most recently with MRI of the breast, we detect the breast cancer early and we cure most of these women. In prevention, we have learned something new in the last 10 years. We have learned that women who are healthy now, but who come from families where breast cancer is very common and is prevailing, these women should receive medications like tamoxifen or Evista to reduce their chances for breast cancer in the future. The clinical trials done in America along that line have clearly shown that we can reduce the incidence of a future cancer in these women by 50%. Cancer is preventable also in many other areas. The most important area is eradication of tobacco smoking. Tobacco smoking is responsible not only for the huge and enormous number of lung cancers in the world, but it's also responsible for cancers of the lip, the mouth, and esophagus. The cigarette kills approximately 5 to 6 million people every year. There is no war in the history of man that has killed every year 5 to 6 million people. It is time for politicians and governments all over the world to implement health policies whereby we eradicate tobacco smoking. I would say the most preventable cancer is lung cancer. And there are many other areas we can talk about the possibility of a prevention. This is why I believe that the debate on healthcare in America was totally out of focus. The issue is not only how to cut cost, but more important, how to cut human suffering by implementing policies for prevention of disease. We cut both. We cut significantly healthcare costs, and we cut down significantly human suffering. And I must emphasize that human suffering in my dictionary is by far more important than cost.
And finally, at what point is scientific research today in cancer?
Scientific research is a process, and every week we have something new and a new development and a new drug. And the most important message from this rapid increase in knowledge and the new development every week in the discovery of new drugs is that a patient who is not curable today may become curable in 6 months with the emergence of new drugs. And therefore, a patient who is not curable today should be treated with this philosophy in mind, that if we prolong his life and we give him a quality of life which is decent and close to normal, it is worth it to prolong his life, though we may not be able to cure him now, but when we prolong his life, we give him an opportunity to receive newer agents in the future. And these newer agents may cure him.